Tonight, an 11 Alive News investigation exposes unusually high rates of thyroid cancer in northeast Georgia.
Now, these neighboring 6 counties you see on your screen have had the highest rates of thyroid cancer in our state for nearly 2 decades. Because of what we found, researchers at the University of North Georgia have launched a study to try to find out why.
11 Alive investigator Savannah Levins breaks the story first here on 11 Alive.
2 years ago, mom of 3, Victoria Hurtado, was diagnosed with thyroid cancer.
I love you. First, I felt denial, like, this can't be real. I'm 30 years old. There's no way I have thyroid cancer. Then the acceptance, then the grief, then the anger, sadness. Come on, jump.
Even after major surgery, the cancer spread. Her doctor unable to provide all the answers.
I asked the doctor, I said, so what causes this? He said, I honestly have no idea.
11 Alive News Investigates spoke to dozens of residents in northeast Georgia, men, women, even children, all facing the same diagnosis and questions. The often overlooked symptoms include a lump in the neck, voice changes, trouble swallowing, fatigue, and sudden weight fluctuation.
There's so many cases popping up, so it definitely makes me think that it's affecting us all. So whatever it is that is causing this is a very strong factor.
So we analyzed CDC cancer data. Around 2006, high thyroid cancer rates began to emerge in northeast Georgia. Incidence rates have been unusually high in this area ever since. Union, Lumpkin, Hall, White, Habersham, and Rabun, 6 neighboring counties, have the highest rates of thyroid cancer in the state, all about double the national average or more over the past decade.
We're noticing that there's a lot of these patients with thyroid cancer.
When we brought these numbers to Northeast Georgia Medical Center, it responded quickly. Endocrine surgeon Dr. Nikita Machado saying the data validates recent fears she and her colleagues have shared.
Our incidence of young patients with thyroid cancer is surprisingly higher than it should be. It's definitely above the national average.
We also brought the data to researchers at University of North Georgia. Dr. Neil Lin, an expert in public health and epidemiology.
The numbers and the comparison to the state and national averages, it is striking, not just high, but it's certainly exceptionally high.
The big question is why?
It may be something that is something related to the infrastructure here.
Doctors Lin and Machado both say finding answers will be dependent on public health officials getting involved.
I think it's important to parse out, is there something here that's preventable? What we need is a partner in the community, and that usually boils down to the Department of Public Health and then epidemiologists.
Georgia DPH reviewed our findings, saying it's not currently allocating any special resources to investigate, but will continue to monitor cancer rates overall.
You're doing really important work here. I think raising awareness about thyroid cancer, really cancers in general, and sort of what to expect and how to not really screen for it, but how to look for it, is going to help us to catch these earlier.
Dr. Lin confirming UNG has started researching efforts to investigate potential causes, acknowledging without widespread support, it may be a long road.
They need to put in the time and investigate and figure this out. The hurdle is to get the funding.
Savannah Levins, 11 Alive News investigates.